Hi, my name is Stacy Ford, and I am implementing in my classroom how to help foster parents when their child has been through trauma. And I'm going to start out with the planning wheel model. So my program design is based on the planning wheel model. I believe that foster parents who are having a hard time establishing a bond with their foster kids deserve to have a parenting education program that teaches them about trauma and how attachment styles play a huge role in what triggers foster kids may retain even long after they have been through trauma. So as a family life educator, we see and understand how hard it is for parents and foster children when they don't have the necessary emotional coping skills to regulate. We want to teach parents how to identify triggers and help them implement replacement tools when their foster kids are in the trauma response. As a family life educator, we also understand how challenging it can be to navigate stressful situations with your foster kids when you yourself don't have the skills or tools to use. That is why we have classes on parenting foster children with trauma. So foster parents can, 1, understand what to do in different situations, and 2, apply the tools to de-escalate trauma responses and facilitate emotional coping skills in foster children. In my classroom, I want to create a welcoming environment where all my participants feel included and safe and can share their experience as foster parents. Also, before they learn all the replacement tools to help their foster kids during a crisis situation, I want them to have access to free resources and tools online to educate themselves on trauma and how it impacts foster children. This program aims not only to support foster parents inside the classroom, but also to have outside resources when they need extra support from people who are educated in the trauma-informed care. My end product. As participants go through this program, they will be encouraged to share their experiences of using replacement tools in different situations with their foster kids at home. Also, by the end program, foster parents will be more knowledgeable about 2 theories and be able to apply techniques from cognitive behavior therapy. This includes 1, teaching skills in emotional regulation, which can help foster kids improve their behavioral responses when they are triggered. The goal of the program is to know what tools foster parents can use in different situations and apply replacement tools when the foster kid is in a trauma response. When the parents apply all these tools and help identify triggers with trauma-informed care techniques, they will be able to establish a more trusting relationship with their foster kids and have a better connection with them. So how do we do this? This will be done in my class by teaching foster parents what to do and what tools they need to use if the child is escalating from a trauma response. I will do this by reading several scenarios in which the foster kid is experiencing triggers. After this, I have my participants role play what specific steps they need to take to calm their foster kids down. In addition, each participant can role play the different attachment styles and see if the others can match the behavior associated with it. Once they can master these steps, then I will see if they can apply the trauma-informed practices with cognitive behavior therapy. After the foster parents de-escalate the situation and form a bond with their foster kids, I will carry out this plan by having weekly classes at the Family Support Center in Ogden on Tuesday and Thursday during the week. The Family Support Center is a place that helps parents with kids who are going through a divorce or parents who are ordered by the court to attend mandatory parenting classes. Also, they offer free childcare for low-income families. The Family Support Center is located in Ogden. To help support retention in my class on trauma-informed care and how attachment style and cognitive therapy are interrelated to each other, I will provide dinner, snacks, and coffee as an added incentive for coming to my class. However, in order for this program to be successful, they need to have an understanding of trauma-informed care, attachment theory, and cognitive behavior therapy before they practice using these tools at home. So how can I break up these theories so my participants can have a general understanding of these three theories? Trauma-informed care is used in health and education setting where both the provider and the survivor of trauma can feel physically and emotionally safe in the environment. The goal of trauma-informed care is to help survivors gain more sense of control and be empowered to make changes. However, in order for this to happen, they need to change their negative thinking patterns and be more aware of their thoughts. So how do they do this? So as a family life educator, there's something known as the cognitive behavior therapy. And this is where, so the actions and thoughts of our brain, they're all interconnected together. So my goal is for them to learn new coping skills for these specific thoughts and behaviors and apply them in their lives. So I have a question for you. Where do we think these negative thoughts come from? And why is it that some children or even foster kids don't feel safe? Well, this is all interconnected to the attachment style that they have toward their caregivers that can impact them as adults. So we now have a better understanding of the three theories. So let's see how the assessment stage as a family life educator is applied. So first, we need to look at the different tools and theories and see how foster parents can apply these tools and theories at home. So we know in trauma-informed care is about feeling physically, emotionally safe. So instead of looking as the behavior is bad or crazy, we're going to focus on that whole person. And instead of saying, what's wrong with you? We're going to look at them and say, well, what happened to their past that had an impact on their current life situation? So who's involved in this assessment part and what tools are implemented to help the audience? A comprehensive approach to trauma-informed care must be adopted both the clinical and organizational level. The principles include safety, trustworthiness, transparency, peer support, collaboration, empowerment, culture, historical, and gender sensitivity. So the first step in providing trauma-informed care to foster children is acknowledging that the behavior outburst is related to trauma. So how can parents respond to this? Well, first, look at the child through a trauma-informed lens and ask, what happened to them? 2, help them by offering grounding tools. So what are grounding tools and what do they look like? So some grounding tools can be a stress ball or a quiet place to calm down. 3, create felt safety by keeping routines and predictable, avoiding physical touch when they are having an outburst. 4, always give them 2 choices to help them calm down. 5, connect and validate feelings before you redirect them. 6, help name their emotions and how they are feeling. 7, keep on building trust through consistency and acknowledge progress. Oh, and then 1, so we've always heard the saying, you need to take care of others, but if you're not taking care of your emotional and physical needs, how are you supposed to take care of yourself? So you do that by practicing self-care. However, not only do these emotional outbursts come from traumatic events, but they can also result from ongoing disordered and negative thoughts linked to trauma. So, for example, a negative thought is, I'm stupid, I'm dumb, I don't deserve this. So this cognitive behavior theory is going to emphasize that our thoughts and feelings and behaviors are interconnected and can play a role in past trauma. And in addition, conditions like anxiety or depression can change patterns of activities in parts of our brain, which in turn can lead to physical sensations. And this could include your heart rate goes up, or even kids have behavior problems. So foster parents can help their foster children, and even parents can help their own children when they are triggered by teaching them these symptoms that are associated with it. Also, they can model relaxation techniques for their children, such as deep breathing, visualization, that can help manage their anxiety and stress. So how does trauma-informed care and cognitive behavior therapy interrelate to the attachment theory? That's a good question, and I had to do a lot of research. So first of all, attachment theory was discovered by John Bowlby. He described attachment as a lasting psychological connectedness between human beings. Bowlby believed that the early bonds formed by children with their caregivers can have a big influence on their life, depending on what attachment style the foster children grew up in. It can influence 1, how they respond to triggers, 2, establish relationships with their foster parents. The 4 attachment styles are ambivalent, disorganized, secure, and avoidant. In ambivalent attachment style, the children show characteristics such as becoming disoriented, freezing, yelling for their caregivers, and then moving away from them. On the other hand, children with avoidant attachment style show no real preference between a parent and unfamiliar adult. For example, if a parent has been gone for the whole day, they pick up their child from daycare, the child will continue to play, avoiding any interaction with the parent. They will also dismiss their own emotional needs so they can avoid emotional intimacy. The disorganized attachment style in children consists of anxiousness and avoidant attachment patterns. Some characteristics include emotional deregulation. They can't properly express their emotions. Also, when the caregiver is present, they move away, but deep down, they want to be close. So how can you, as a parent, implement all these theories and tools with your children? It's pretty hard. First, when the foster parent provides trauma-informed care to foster children who have disorganized attachment styles, they are creating a secure base and understanding how trauma shapes attachment patterns. So once they find out the attachment style, they have more of an understanding of their developmental needs and what emotional bond they have established in the past. Then in turn, they could practice tools to manage thoughts, feelings, and behaviors. Okay, so I have some long-term goals for my class. After my participants have completed my education class on how to use trauma-informed care, cognitive therapy, and attachment style, they will be able to apply these tools to identify triggers and establish a secure attachment for foster kids. For example, because the foster child trusts the parent, the foster parent will be able to calm their foster child down by teaching them how to regulate their emotions by using grounding drills such as taking a deep breath, squeezing a fidget toy until they are calmed down, and identifying triggers. For example, when they have triggers, the foster child will be able to identify where they come from and work through it with the foster parents. However, in a year, not only will they be competent in all these theories and how to use them, but they will be able to confidently help their children by de-escalating the situation when they are experiencing intense triggers from trauma. Also, they will be able to identify what attachment style their foster kid have and use replacement tools to get them out of fight, flight, or freeze response. So what is fight, flight, and fight, flight responses? Basically, it is the way our body responds and reacts to danger. So if someone is yelling at you, or trying to attack you, one response is to fight, in which you aggressively confront the perceived danger. Another response is flight, where your brain and body is in physical danger and you remove yourself from the situation. However, some people who have been through a traumatic event they can't comprehend what is happening to them, and so they dissociate from it, and it's a way of protecting them. Another one is freeze response. And so this is basically where they won't do anything. However, sometimes their body will go into a fawn mode where the foster child is trying to avoid conflict or harm, so they please the person they are scared of. For example, a husband starts yelling at his wife because the dishes aren't done. Instead of defending herself and using assertive communication, the wife goes into the fawn mode, shuts down, and finishes the dishes. After learning, so now I'm going to talk about the short-term outcomes for participants. After learning all the theories, my participants will be able to identify attachment styles and the triggers associated with them, be able to use trauma-informed care when the foster child is having triggers from past trauma, then be able to identify what attachment style is associated with that behavior. Then when the child is calmed down but still exhibits negative self-talk due to adverse child experiences, the foster parent can use one strategy such as cognitive behavior therapy to help reframe these negative patterns. One strategy the foster parent can use is to differentiate between problematic and normal behaviors. After foster parents do this, instead of focusing on the negative behavior, praise positive attention and other rewarding consequences for problematic behavior. Negative consequences are not effective in the long run. That is why it is so important for foster parents to educate themselves on common reactions to trauma, as well as normative behavior and emotional sexual development. So I'm going to have a pre and post test. For my pre-assessment, I will have the participants participate in a survey about all three theories and how they could use them in a real situation. What are the first steps for a foster kid that is in a trauma response? For post-assessment, have my participants model what triggers are associated with different attachment styles and what techniques they can use from cognitive behavior therapy to help a foster kid who is in a traumatic response. So what are the benefits of the post-test measures? The pre and post. The pre-assessment is beneficial because it shows how much they know about all three theories and helps me as a family life educator individualize the lesson plan to meet where they're at. For example, avoidant and disorganized attachment styles have similar characteristics that lead to specific triggers. So if they don't know the general information about the two attachment styles, then they can't help their foster kids when they are in a trauma response. The post-assessment is given after my 8-week course to see how many concepts they have mastered and if they can apply these different strategies and integrate all three theories and tools when they are de-escalating different behaviors due to trauma from foster children. Once I see where my participants are at when they model what not to do, I can tailor my lesson plan for the next participant. Section 3, outline agenda for class. So in the planning wheel model, one of the steps is focused on the outcome of the goal and the end result of the class. I will use parts of the planning wheel model in my class. When they first come into my class, I will have them sit down on a chair with a desk. I will give them a grace period of 10 minutes to find my classroom and get situated in the class. Once everyone is in the seat, I will hand in a paper with the expectation of class. Then I will go around the room and ask each participant if they want to read a paragraph of the paper. They can have a choice if they want to participate in reading the paper, if they want to skip reading the paper. After we've gone through the class rules and expectation of the class, I will ask the participants if they have questions or concerns about the expectations of the class. After I've read my expectations of the class to make it more fun and engaging, all the participants will have a choice to stand up from their chair and go sit down on the carpet. They will have two choices, to sit down on the carpet or the option of sitting down on a beanbag. After they are engaged and comfortable where they are, I will go around the circle and ask them their name and what they hope they can learn this class. After we do this get-to-know activity, I'll turn on my screen projector and we'll watch a video on YouTube about what trauma is and the attachment styles that are associated with it. Once the video is over, I will go around the room and ask them questions about what stood out to them. Then I will assign the participants into two groups. They will go back to their desks and pull out an index card that has a behavior associated with one of the attachment styles. On the wall, there will be posters with different attachment styles and pictures of what they look like. Then I will pick a group to come up and put the behavior or symptom with that attachment style. Once all the participants are done with the activity, they will sit down on their chairs and take a multiple choice quiz about behaviors and symptoms associated with that attachment style. When the participants are done, they will turn in the quiz. I will hand them a worksheet where they match a specific scenario with the attachment style. So this is my class. The activity we're gonna do is this one. Hi, welcome to class. Please make yourself comfortable and find a desk and a chair to sit down. We will start class in 10 minutes and give other participants time to find the class and take their seats. All right, time to start the class. I want everyone to look at their desks. What do you see? This is a paper with expectations of the class. What are we going to learn in the class? Now I'm going to start in the front row. If anyone wants to read the paragraph, take a turn. If you don't want to, you can just say pass. Does anyone have questions about what we discussed? Okay, let's see what's next on the list for class. Everyone stands up and goes to the carpet. You can either sit on the beanbag or the carpet. Now that we are comfortable, I'm going to go around the room and ask your name and what you hope to learn about trauma-informed care. Now we're going to watch a YouTube video of trauma and the behaviors and symptoms associated with a specific attachment style. Okay, we're done. What surprised you about different attachment styles? Do you identify with any of the attachment styles? Okay, so here are some discussion questions. What stood out in the video? What is the main difference that you saw in the video about anxious attachment compared to disorganized attachment style? As a foster parent, do you feel triggered when your foster child is having a trigger and it turns into a meltdown? Okay, we're moving on to activity 2. Match attachment styles with triggers and behaviors associated with them. The participants will sit in their seats and the person sitting next to them will be their partner for the matching game. I want to thank everyone for participating in the welcome activity. Also, thanks for sharing what you learned about attachment styles. After we went over the discussion question after the video, now we're going to switch the focus to trigger behaviors associated with the attachment style. Look on your desk. You will see index cards with different scenarios. After you read this scenario, I want you and your partner to match the behavior or symptom on the card on the poster board. I want you to tell us why you chose the poster board with that specific attachment style, then sit back down in your seat. Activity 3, worksheet on different attachment style and the triggers they have related to trauma. I want you to think about what stresses you out daily or even memories you still think about. How did it make your body and mind feel when you think about it? Now I want you to imagine as a kid, you're going to live with a new family. You don't know anything about the family. So the foster kid is settling down into the new place. Their foster dad is walking in the door and slams it. The foster kid is triggered by this memory. Now think about what you pictured and learn today throughout the class and what you do when you're stressed. After you're done thinking about this, let's get ready for the quiz. On the quiz, you will match the scenarios of the attachment style with the behaviors or trigger foster kids experience. Then on the next page, you will answer 8 true and false questions from the video. You will have 15 minutes to complete it. After you're done with the quiz, you will bring it up to my desk and will hand you 2 pages to complete at home. Homework. Work on attachment styles. Identify attachment styles with fictional characters and case studies. After the second part of the worksheet, match the attachment style associated with specific characteristics. Section 3. Checking in on homework. Follow up with the foster parent sessions on attachment and behavior characteristics associated. Hi everyone, how are you doing today? Before we move on and talk about different theories that are associated with trauma, I want to talk about 20 minutes and go over your homework. Don't worry if you didn't finish it or get the answers right. It's all about the learning process and applying this outside class. So your assignment was to match attachment styles with the behavior triggers for the first page. The second part was to see what information is true or false about specific attachment styles. Does anyone have questions for either parts of the assignment? Oh, raise your hand and give feedback. I would love to hear what was hard about the assignment and if you learned anything about attachment style. Also learning about attachment styles, are you as a foster parent able to more easily recognize attachment style, your foster kid and characteristics they have? Give time for the participants to raise their hand and share their experience at home. Section 4, homework on trauma-informed care. I think this is it. I think it's too long, John.
It's okay, you're only at 25 minutes.
Oh, okay, I'll just do it. Okay. Okay, expanded go. Let's see. I lost. Okay. Have a core understanding of attachment theories. Be able to know the main difference between avoidant attachment styles and disorganized attachment style, secure attachment style, and anxious attachment style. Be able to recognize how early trauma can change attachment styles. Be able to know how anxious and avoidant attachment styles are similar and different. That way, if they compare and contrast, they grasp the material better. Recognize the main characteristics of each attachment style. Secure attachment style, where they establish a bond with their caretaker when they feel safe, connected, and supported. They can express their emotions freely and seek comfort from their caregiver. Actively moves to the caregiver for reassurance. The child looks to the caregiver when frightened or hurt. It accepts comfort quickly from the caregiver. Disorganized attachment is when the caregiver is inconsistent and hard to predict their behavior. Withdrawing from the caregiver. Excessive anger, unpredictable, close to caregiver but distant at the same time. Avoidant attachment. The child is indifferent to the caregiver's presence and avoids them upon return, which means emotional disconnection. They're distant, they're unemotional, and they avoid closeness. Anxious attachment is an insecure attachment style that is characterized by a strong desire for intimacy with the caregiver and fear of abandonment and rejection. Always misses the caregiver, highly emotional, seeks assurance. A lesson plan to recognize the different attachment styles. The duration of the lesson plan will last 60 minutes, and the goal by the end of the lesson plan is to identify the characteristics of each attachment style. First, we're going to watch a 10-minute video clip showing different attachment styles. Then I'm going to divide you into groups of 4 and hand you cards with different scenarios. Each card will have a story that presents children who have different characteristics from attachment style. This will last 15 minutes. Then they will read the scenario based on the main characteristics of the attachment style. After this, I want each person to come up in front of the class and look at the poster boards with different attachment styles around the room. Then match the scenario with characteristics associated with that attachment style on the poster board. After they do this process, I want them to switch groups and model the main characteristics of the attachment style and which one is in front of the class. The activity will last for 20 minutes. Then they will sit back in their seats and I'll pass out a quiz on attachment style. On the quiz, they will be given 6 scenarios of children who have specific attachment style. Then they have to match the scenario with the attachment style and the specific characteristics associated with it. The quiz will last 15 minutes to complete. After they leave it on my desk, class will be over. Expanded goal. Steps to take when foster kids are escalating by applying trauma-informed care for triggers. 2, recognizing attachment style, then know what cognitive behavior tools to apply depending on attachment style. Recognize practices from trauma-informed care. Have the parent stay calm and regulate their emotions. 2, ensure physical and emotional safety. Remove existing demands and don't make additional ones. 4, validating feelings but no actions. Be aware of space, maintain distance, be aware of facial expression. 6, remain calm and never yell when they are in trauma response. Offer 2 choices, use grounding techniques, avoid conflict with them, reassure connection. What cognitive behavior therapy techniques can you apply once you're in once you use de-escalation tools? Cognitive restructuring, mindfulness, problem solving, cognitive diffusion. Lesson plans to learn the steps of applying trauma-informed care when foster children are escalating. Model with your partner what to do and what child trauma response is. What are the steps to calm down? Instruction. Separate the participants into groups of 2, then have them pick up index cards on their desk. The index cards will have a case study of what each parent did to calm the child down. After that, choose the card that applies to the informed trauma care. The 2 participants will come up in front of the class and look at the card. Then model what and what not to do with trauma-informed care techniques. Icebreaker. So how was your weekend? Were you able to practice what you learned about attachment style and behaviors triggered with it? They raised their hand. Script. So today we're going to talk about trauma-informed care and how it can be used in different scenarios. What are the wrong steps to take and what are the right steps to take with trauma-informed care? Activity 1. So first, the person right next to you will be your partner. Your partner will pick up 2 index cards with a case study of a person with trauma. On the back of the card, it will have specific steps of what to do when the foster child is escalating. 1 index card will be the correct steps, and 1 will be the wrong steps after you and your partner choose an index card with the right trauma-informed steps. You will come up to the classroom and read what you picked and why. Your classmates will then guess which is right and wrong on trauma-informed care. Then after you look at the cards, you will put them on my desk. After you role play what to do and what not to do with trauma-informed care, then you will sit down and I will call other participants. This activity will last 30 minutes. Activity 2, identifying triggers and apply trauma-informed steps. Divide the participants into groups of 4. After handing them an index card with a scenario that could trigger the child, have them read their cards after each group reads their cards. Have them come up with strategies and techniques they put in their trauma-informed toolbox that would help with emotional regulation, safety, connection with their foster kids. Then have each group share a tool with the whole class. After each group can present their trauma-informed toolbox to class and tell them what strategies they would use and why. This should take about 20 minutes. Script. Icebreaker. Hi, welcome to class. I'm so glad you came today. Does anyone remember what we talked about last week? That's right. We talked about the steps of trauma-informed care and how to apply them in different scenarios. Today we are going to go a little deeper into trauma-informed care and what tools to use when they are escalating. First, I'm going to divide you guys into groups of 4. Once you know your group, you're going to sit at the table and get to know each other. After one of your group members will pick up an index card with a scenario where the child is triggered. Then they will read it out loud. And after all the groups have read their cards, I'm going to hand each group a blank paper. Then each group will brainstorm and write down a technique or strategy they can use for the scenario on the card. After you guys can present either by going up in front of the class or sitting on the chair. I want you to tell me why you applied this technique and when it can be used. Thanks everyone for participating today. We all learned a lot from each other. Make sure on my desk you pick up a worksheet with the homework on it. Okay. Thank you.